Hi everyone, welcome back to my channel. If you're new here, I am Jamie. I'm a pelvic floor physical therapist. Officially have been in my new role for a couple months at my new clinic, so I'm very excited. And today I'll be chatting about the final video of the Better Bladder series, finally. And I'm very excited to share these techniques to help evacuation of urine be a nice passive activity. You never want to be straining for bladder emptying, and we'll talk about why this positioning is important for pelvic floor health as well. So before we get into the positioning, I do think it can be helpful to understand why we're doing what we're doing. So when we think about urination, the bladder is going to have to contract for urine to be evacuated. So this is done through smooth muscle, which makes up the bladder wall. And you can think about bladder and pelvic floor doing opposite actions. I know we had talked about that in previous videos, so if you have not finished the first 3 in the series, be sure to check those out. But where bladder is going to kind of insert is through urethra. So there's that connection, bladder, and then urethra allows for the exiting of urine. So when pelvic floor is relaxed, that allows bladder to contract and allows the urine to pass through the urethra and urethral sphincters. If we're not properly relaxing pelvic floor, that can lead to difficulty with urination, causing extra straining and force, which we should never be doing. So if you think about, bladder kind of sits on top of urethra, and then the pelvic floor surrounding urethra and supporting bladder. So they need to be doing kind of the opposite in order to get the job done. So for positioning, I'll be using my office chair, but this is going to be simulating what you would do on whatever toilet you choose to urinate at. So first order of business is you never want to hover when you're urinating. You want to make sure your bottom is in contact with the toilet seat. If you are someone who is uncomfortable sitting on public toilets, be mindful that they really are not the dirtiest things out there. There could be much worse. But also, if you are concerned about sitting down to pee, bring either your own disposable toilet coverings, or if they're available, use them, or you can kind of make your own with toilet paper, or if you really want, carrying an antibacterial to wipe down the toilet before. Whatever you have to do to make sure you're sitting down is very important, because as mentioned, if pelvic floor is active and it is not fully relaxed, then bladder is not able to contract and fully empty bladder. So that will lead to straining and trying to do whatever you have to do to get urine out. But that can be prevented through proper positioning. So after you're sitting down, you're gonna think about bringing your knees a little bit wider than hip. So feet stay flat, but knees come out just a little bit, and that's gonna help quiet your adductors or inner thigh muscles, which do attach at pubic bone and have a close proximity to urethra. So we wanna make sure pelvic floor and adductors, all the muscles surrounding pelvic girdle, stay nice and quiet in order to relax fully for bladder emptying. And then the last thing with positioning is a little bit of a forward lean and a relaxed belly. So think about guts out. I know it can be uncomfortable as a society. I feel like we're always trying to suck our gut in and look as thin as possible, but you really want to be letting your belly just hang and relax. You want abdominals to be quiet as well, because they work synergistically or together with pelvic floor. So if one's active, the other is going to be active. So having both pelvic floor, adductors, and abdominals relaxed, you're setting yourself up for success to allow urethra to not be as constricted during urination. So with one of the pelvic floor muscles, urethra compressor, wrapping around urethra, then if we're relaxed, it allows for urine to pass easily without straining. So once again, sitting on the toilet, no hovering, slightly wider than hip distance with your thighs, gentle lean forward, and then just think about breathing, relaxing, trying not to tense up, because this will help to just have that passive bladder emptying without having to put any work in. You should be able to sit and urine flow freely. You should be sitting, and urination should take, at least 10 seconds or so. If you're getting just drops, then I would refer back to future videos in the series to learn what habits may be contributing to a disruption in the bladder's ability to detect when it's full, such as those just in case voiding. So pretty simple today, but these are some quick tips that you can try for urination. Really comes down to sit down, make sure everything is nice and relaxed, don't push to pee, and don't rush. So hopefully this was at least a good reminder, and if you have been doing hovering or straining, hopefully this was educational in learning better bladder technique. So thank you all for joining me for this Better Bladder series. If you have any questions, concerns, or hoping for more detailed video on any of the things we've talked about, any other topics, please comment below. Be sure to subscribe if you enjoyed this and are interested in seeing more PT related content. I can be found on Instagram at Loom Pelvic Floor PT, as well as TikTok. So be sure to follow that for some other fun content. Otherwise, thank you so much for watching. I look forward to seeing you very soon. Bye.